Good morning, I'm Vic Senese and welcome to UroNurse News. Today we're looking at a fascinating new study that may change how we approach early urinary incontinence after radical prostatectomy. A team of researchers in China, led by Dr. Xuefeng Qiu from the Nanjing University, has found that electroacupuncture applied to specific acupoints on the bladder meridian can significantly accelerate the return of urinary continence. Post-prostatectomy urinary incontinence is a common issue, affecting up to 86% of men at 3 months due to surgical damage of the urinary sphincter or its nerves. Now, in this trial, 110 men who experienced urinary incontinence 1 month after surgery were randomly assigned to two groups. First group, electroacupuncture group, received 18 30-minute sessions over 6 weeks with needles at the Ciliao, Xialiao, and Xialiao points, alternating stimulation between 2 to 15 hertz. Now, sham group received non-penetrating needles placed near the sacral foramina. Both groups also performed daily pelvic floor exercises. At baseline, patients were using about 2 to 3 urinary pads per day, weighing roughly 500 grams after 24 hours. The median age was 69 years old, and average BMI was 24 to 25. After 6 weeks, the results were compelling. 43.6% of men receiving electroacupuncture achieved urinary continence compared to only 21.8% of the sham group. That's essentially double the chance of early continence recovery. 2 times, that's pretty good numbers. Fewer urinary pads reduced by 0.5 pads on average, lighter pad weight after 24 hours, 140 grams less, and lower scores on the EPIC-CP, a measure of post-prostatectomy urinary function. The time to return to continence was also shortened in the electroacupuncture group, with a hazard ratio of 1.65, though over a 20-week follow-up, differences between the groups narrowed. 76.4% versus 67.3% continence, which was not statistically significant. Interestingly, subgroup analysis showed that patients who had nerve-sparing surgery, whether unilateral or bilateral, benefited the most from electroacupuncture. Those without nerve-sparing procedures did not see a significant advantage. Adverse events were minimal, with 1 needle insertion pain and 1 subcutaneous hemorrhage in the active group, and 1 local muscle spasm in the sham group. Now, the researchers cautioned that this study was small and single-centered, so broader generalization is limited. Still, the conclusion is clear. Electroacupuncture appears to safely enhance early urinary continence recovery after radical prostatectomy, though it may not change long-term outcomes. This is exciting news for urology patients and practitioners seeking non-pharmacological interventions for post-surgical incontinence. And as I mentioned earlier, from my many years in urology, that bothered patients the most. Men just don't want to tolerate being incontinent, and hey, I can't blame them. Well, that wraps up today's briefing. Stay tuned to UroNurse News for more updates on innovative patient-centered approaches in urology. Tomorrow on UroNurse, managing urinary health just got easier. Meet ProudP, the powerful app for your phone that combines uroflow monitoring and a video diary in one simple, easy-to-use tool. And get this, there's no other device necessary, just your phone. You have to watch to find out how this works. So whether you're a patient tracking symptoms at home or a healthcare professional monitoring remotely, ProudP makes gathering accurate, real-time data simple, helping improve urology care and outcomes. You're not going to want to miss this one. Like I said, this is pretty impressive. Only on UroNurse.com tomorrow at 9 a.m. Central Time. I'm Vic Senese. Thanks for watching, and you know the routine.
UroNurse News, we've got the scoop, helping you stay in the healthcare loop. From Monday to Friday, we bring the view. UroNurse News, straight to you.